One of the most common diseases for us human beings is diabetes or pre-diabetic status. With pre-diabetics, I mean that either or both of our parents are diabetic and we are developing certain signs. Today, we will be discussing how to catch if you're pre-diabetic, how to know that you've developed skin diabetes, which is the first stage to diagnose that you've developed diabetes, or how to take care of your skin if you are diabetic. Most commonly, all the diabetic and the pre-diabetic people will have more susceptibility, more chances of bacterial infections, dry skin, fatigue skin, dehydrated skin, yes, dry, itchy, flaky skin, which can lead to bacterial infections. Both staph and streptococcal infections is seen very commonly. We see styes, we see boils, we see furuncles, we see carbuncles. This is all in medical terms, जिसे मेरे को मरीज आके कहता है बाल तोड़. Yes, very commonly. So apart from that, there are a lot of various kind of infections, fungal infections, alopecia areata, which is an autoimmune disorder. Many of diabetics develop necrobiosis lipotica, which can also be seen in non-diabetic individuals, but very common in diabetics. It starts as a basic small papule like a little pimple, and it will evolve into a yellow or a reddish brown pigmentation. It happens because of the blood vessel changes in it, and there is a lot of immune cells which goes and sticks around over there. So yes, it is very commonly seen in diabetics. Also, we see something called acanthosis nigricans, which is basically velvety black pigmentation, which is very common on the folds of the skin. You see it behind, on the nape of the neck, you see in the underarm, you see in the elbows, in the inner side, you see it on the various creases in the inframammary areas. So yes, it happens because of increased insulin, and interestingly, I find acanthosis nigricans in Indians particularly as the earliest pre-diabetic marker. For developing diabetes, the most important test to keep in check is your HbA1c levels. It is like a mean average which tells you about your blood sugar levels, and if you have some pre-diabetic history and you have these signs and symptoms, please do your test at least once in 5 to 6 months. And something I always like to say, keep changing your lab. Yes, if you like 2 labs, do it with one lab at one time and with another at another time. In diabetics, we also see physical alterations very commonly, of course, due to weight gain. There is stretch marks, there is pigmentation, there is dry fatigue skin, there is a lot of irritated kind of skin patches sometimes. There is something called shin spots. Shin spots are very commonly seen, which are also like 8 spots but can happen in the 20s and 30s. Very common in diabetics is the slow healing of cuts and wounds. Yes, a simple cut can become badly infected. A small cut can become a big wound, can develop cellulitis to the extent that somebody may even have to go in for amputation. So do not ignore minor cuts and minor wounds. Get them corrected instantly. If you are diabetic, very important that you should know basic first aid kit. Well, my favorite always has been potassium permanganate, जिसको पिंकी कहते थे पहले, KMNO4 crystal soaks. So that is the cheapest, easiest and best antibacterial, antifungal remedy. It releases nascent oxygen, clears our skin completely and purifies us and helps us. So if you've developed a small wound and you are diabetic or pre-diabetic, good idea to dip it in pinky, which is potassium permanganate soaks. Do that for at least 5 minutes morning, evening, and put an antibacterial cream of your choice. If you've developed a fungal infection, it's very important to visit a dermatologist beside using an antifungal cream and powder on your own. But if it's not going, do not ignore it. Well, type 2 diabetes comes along with obesity. So there is a lot of, accumulation of subcutaneous fat at various places. There are going to be fat pouches on the body, which are difficult to ignore because they form like different patches. So yes, that's also one of the skin markers. Acrocodons in medical terms, this is skin tags ya masse kaha jata hai. Skin tags is very common. People who wear gold chain, even in men, it's very common to develop because of the friction. But if you're not wearing a chain and if you have family history of diabetes, if you've developed, say, acanthosis nigricans, the black pigmentation, and you have skin tags, go ahead for your HbA1c test. These massas, please do not treat them with the local remedies which are very common कि वो घोड़े की बाल या वो गाय की किसी का बाल लेके पूंछ से they tie it and it becomes infected if you're diabetic. I've had patients who've had to get admitted in hospital doing these kind of remedies. Of course, some of them who had no problem. But I would say please avoid these kind of remedies, and if you have skin tags, visit a dermatologist if you want to get rid of them. It's the easiest way. Radiofrequency laser is done and they can be snipped off in no time. So we discussed few telltale signs for pre-diabetes and diabetes today. Hope it's been helpful. Please leave your comments so that we can get back to you and also suggest us more topics that you would like to hear from us.